nurse, as Deb said, and I've been in healthcare for nearly 40 years. And public speaking is not my forte, but I'm angry and I'm passionate about this resistance, and those are strong motivators. Like many healthcare workers, I went into nursing because I wanted to help people during what is often their most difficult and challenging times. And I've always worked for a not-for-profit healthcare institution because I believe healthcare is about caregiving and not profiteering. I have significant concerns about the disastrous impact that the Trump budget bill will have on our country's healthcare system. Let's just see how widespread this will be. If you are a Medicare recipient or have someone close to you on Medicare, please raise your hand and keep it raised. If you're on Medicaid or have someone close to you on Medicaid, please raise your hand and keep it raised. If you're receiving insurance through the Affordable Care Act, Healthcare Exchange, or have someone close to you who is insured due to the ACA, raise your hand and keep it raised. Now look around you and see just in this crowd alone how many people are going to be impacted, probably quite negatively, by this bill if it passes. Let's talk about that impact. Medicare is anticipated to be cut by $45 billion in 2026 alone, and that will grow to $535 billion over the next decade. In this state, over 600,000 people were insured through Medicaid when we expanded Medicaid just a couple of years ago. North Carolina was late to the table on that. And we stand to lose that insurance coverage for those 600,000. And nationally, up to 14 million could lose their Medicaid if the new work requirement passes Congress. The Affordable Care Act, enrollment in that program is going to be much more difficult, and premiums will go up by $400 to $3,000 annually based on income. And that will make the insurance out of reach for a lot of people. On a personal level, I have family members who are on Medicare, and they will not be able to afford these increased costs. My daughter is disabled and on Medicaid. I will not always be here to take care of her, and I would like for her to live in a country where health care is a right, not a privilege for the wealthy. I also have a very close friend who is not only surviving but is actually thriving stage 4 cancer because of her insurance through the Affordable Care Act. I worry every day if she loses that, what might happen. So let's make no mistake about it. I won't sugarcoat it. Our current healthcare system is broken. I think a lot of us know that. And I've seen personally a young man barely into middle age who comes to the hospital with such a high blood glucose level that he's in organ failure and he doesn't recover. He died because he couldn't afford insulin. A grandmother who's repeatedly readmitted to the hospital with heart failure. Her daughter and grandchildren have moved in with her, and she is only taking her medications every other day so she can stretch her budget and feed her family. And I see the children of elderly parents on a regular basis who are trying to hold down a job to meet their family's needs and try to figure out how to take care of their failing parents in a healthcare system where assisted living and long-term care costs thousands of dollars per month. This system needs more resources and better solutions. It doesn't need to be stripped of its funding to harm even more people. We need a new plan, and Trump does not have a plan to improve our health care at all. Hospitals, especially rural hospitals, will have to close due to these cuts, and it's going to cost far more money in the long run to take care of people who are in a health care crisis because they couldn't afford to manage their health care condition and they didn't get preventative care. It's anticipated that the cuts in this bill will be responsible for 51,000 deaths annually. So I brought a sign today, and it has one word on it, and that says nope. And the E is a crown, because we don't want crowns in America. So, no kings. So I have a few questions for you, and if you answer in the negative on these, please respond by saying nope. Are you going to stand by and let this administration destroy our healthcare system? Are you going to let them frighten you and silence you with their threats of violence and fear-mongering tactics? Are you going to be one of the people who look back and say, I did nothing and should have done more? Because of people like us and the people attending the 2,000 plus rallies being held today across our now divided United States of America, we can win this fight. We can help save lives and provide care to those who are being targeted, bullied, and marginalized. That's why I went into healthcare. And when people look back at the Trump administration and the atrocities that were committed, the people here today will be on the right side of history. Thank you.